without health insurance, you could have a little bit of an uphill battle, but I don't think people should get totally discouraged because there are a number of organizations, both private and public, some government sponsored, that can help you financially. You need to do your homework. You need to seek these out. They may not necessarily be just handed over to you. You need to establish that you have a need for either no or low cost help. Maybe you need to be subsidized, or maybe you need the entire tab to be covered. Local hospitals sometimes offer free care, particularly teaching hospitals. You should contact the National Cancer Institute. They have some funds set aside. You can call 1-800-CANCER. They will do free mammograms, and sometimes they will pay for treatment. You should contact the social worker at your hospital or at your cancer center. Social workers are trained to know resources, financial and otherwise. You might need a caregiver in the home. You might need help with housekeeping. You might need rides to and from treatment. There are a number of ways in which they can set up help and support for you. In fact, elder care, if you are someone 65 years of age or older, can offer you a lot of that type of assistance, picking you up, dropping you off, providing meals, things of that nature. Also, the public health department, you can contact your local public health department and ask them for what local programs are available to assist you financially. You can contact the Susan G. Komen Foundation or the American Cancer Society. They have, Susan G. Komen raises millions every year, and they will pay for mammograms. They might assist with care. I would contact the pharmaceutical company if you're going to be on chemo. You call the pharmaceutical company that manufactures the specific drug you are on, and almost all of them, if you can establish evidence that you don't have the funds to pay for this drug, they will pay for that drug. Some will pay 100% for the duration of the chemo. Some will subsidize it and lower the cost, and then maybe you can supplement with another source of funding. This is sometimes called compassionate care. I think they all, want to stay good friends with the community at large, and they want to have a positive, reputation within the industry. So they're very eager to help people who are truly in need. All 50 states and the District of Columbia have Medicaid coverage for breast cancer. So if you are on Medicaid, if you are disabled, you're receiving SSDI, you will probably be able to be eligible for financial assistance. The CDC, or Centers for Disease Control, and the National has established the National Breast Cancer and Cervical Cancer Early Detection Program, and that is a good means of assistance. Now, Medicare, of course, offers health coverage, health insurance. If you're 65 years of age or older, or you're disabled, you will probably be eligible for that. There is a toolkit that I highly recommend. I'm going to show you that now. This is through the National Coalition for Cancer Survivorship. It covers everything from A to Z if you are diagnosed with cancer, and a portion of that is about financial assistance. They list some organizations such as AARP, again, the American Cancer Society, or ACS, the American Chronic Pain Association. Maybe you are suffering from chronic pain and they might give you assistance for your pain meds. The National Association of Community Health Centers, they can give you a list of local nonprofit, community-owned healthcare programs serving low-income and medically underserved urban and rural communities. So that's all listed in this toolkit that I have mentioned. There are many private and there are many religious affiliations I can't even remember the names off the top of my head because I've heard about them over the last 6 or so years. I have not had, I have health insurance, so I have not had to seek this help. But if you are in that situation and you go in to the internet and you Google, you'll probably come up with a number of religious and non-religious, private and public organizations that can offer assistance at various levels. Some can cover all, some can cover some. There is a lot of help out there. So I urge you not to be discouraged and not to feel you can't afford this treatment.